All right. Hi, everyone. My name is Paris Bell, and I am one of the students who have the opportunity to be a part of the Script Your Future campaign. This campaign is led by faculty, the Script Your Future campaign, and students to provide awareness to communities about ways to improve their health. My webinar series will be on diabetes management and specifically empowering diabetes management and some tips to successfully manage diabetes in everyday life. So I have an objective slide here, and the three major objectives are to distinguish between type 1 and type 2 diabetes. The second objective is to identify what it means to empower diabetes management. And the third objective is to describe strategies to manage diabetes. So first things first, we've heard of diabetes, may not have heard of diabetes, whether you're newly diagnosed or whether you've lived with diabetes for quite some time. Overall, it's a disorder in which patients experience high blood sugar. And these high blood sugar levels can result from either a deficiency in insulin altogether, so we're not producing insulin, or a defect in insulin action. So maybe a patient is making insulin, but it's not allowing the right amount of glucose to be entered into cells so that those cells can use it for energy. There are two major types. We have type 1 diabetes, which is a chronic condition in which the pancreas produces little to no insulin. And without insulin, we have high blood sugar because the sugar can't go into cells so that the cells can use the glucose. And then type 2 diabetes is a chronic condition that affects how the body utilizes insulin to lower blood sugar. So we might have very little insulin that's being produced. We might have a lot of insulin that's being produced, but the problem is that the insulin does not quite allow glucose into cells so that those cells can use it for energy. Overall, 37.3 million people, which is about 11.3% of the United States, have diabetes, and reducing the prevalence of type 2 diabetes and its costs are usually a primary concern. But for both type 1 and type 2, changing eating habits and incorporating lifestyle changes slow its severity for those who are already diagnosed and living with diabetes. So our next objective is defining what it means to empower diabetes. So what does it mean? Empower means to give authority to something or give power to something. So therefore, our goal is to give priority and authority, number one, to diabetes because it is a life-changing chronic condition, and two, to properly manage the diabetes, to encourage patients who have diabetes to take charge of their diabetes in order to maintain a healthy lifestyle. So I have 7 major strategies to manage diabetes. And the first one is finding a diet or a meal plan that is suitable for you. The second one is finding an exercise routine that works for you. The third strategy is monitoring adherence. The fourth tip is including others in your journey and forming a support system. Diabetes is life-changing, and it can be very isolating if you don't have a team that supports you. And the fifth one is checking blood sugars frequently. We want to monitor the progression of our diabetes and hopefully slow down the progression of diabetes. Number 6, which is my favorite one, is have fun. A lot of people might think that diabetes is, counting and micromanaging, what you eat, but you can have fun creating fun meals with family, developing really fun exercise routines, finding plans that will help you have the most out of your daily life, activities of daily living. And number 7 is getting involved. And I am very passionate about volunteering. And I do believe that getting involved with your diabetes and, supporting the American Diabetes Association could not only give awareness to others, but also provide that feeling for yourself that you're accomplishing something in the process of managing diabetes. So the first tip is finding a meal plan that's suitable. So patients with diabetes have to pay close attention to what is being consumed throughout the day. When you eat foods that are extremely high in carbohydrates or simple sugars, so things that are easily broken down and often spike glucose sugars, those can really cause detrimental events the more it happens over time. So one consequence is gradually raising A1C levels. And it's important to find a meal plan that not only accommodates you, but accommodates the diabetes. And this is, the most ideal. And I do have some suggestions here. So the first one is the Atkins diet. The second one is a plant-based diet. The third one is a Pescarian diet. And the fourth is a Mediterranean diet. And I'm going to go through each of these diets one by one. But before we go through each individual diet, it's very important to understand the guidelines from the American Diabetes Association. So there are criteria that the ADA covers, and ultimately what criteria should be met depends on the patient and the ADA. So what criteria should be met when we're formulating a meal plan? So for managing diabetes, the most challenging part of any treatment plan is determining what to eat. If you're newly diagnosed as a diabetic, you're probably thinking, oh my goodness, I can't have sugar, I can't have carbs. That is very incorrect. There's no one size fits all eating pattern. So one diet that works for one patient could be very different than what works for another patient. Meal planning is extremely individualized. Nutrition therapy plays an incredible integral role in overall diabetes management, and each person should be actively engaged when developing a nutrition plan. So now that we know the criteria that have to be met, let's see what the ADA suggests. First things first, carbohydrates. So carbohydrate intake should really be nutrient dense. Okay, so when we're talking about nutrient dense, we're talking about carbohydrates that are high in fiber. So the ADA recommends at least 14 grams of fiber per 1,000 kilocalories or calories, and really limiting the processed carbohydrates. So a really good example is white Wonder Bread versus multigrain wheat bread. Another example, sweet potatoes, brown rice, bananas, blueberries, quinoa, strawberries is also another really good example. So really fibrous carbohydrates that are really important, and they're also broken down much more slowly than simple sugars or simple carbohydrates. If patients are on a flexible insulin therapy program, education on the glycemic impact of carbohydrates has to be tailored to the individual's needs and preferences. This is very important. So if a patient is using, X amount of insulin before each meal, it's really important to be educated on which carbohydrates you're consuming in that meal. If you have a lot of simple carbohydrates, maybe that, flexible insulin program needs to change, right? It needs to fluctuate. So if you're eating, let's say, a bowl of oatmeal, you might want to take X amount of insulin. Well, let's say we're swapping out that oatmeal for a multigrain toast and a poached egg. Well, maybe we might need to dial down the insulin because we're not really eating a significant amount of carbohydrates, and they're complex carbohydrates, which means they'll be broken down much slower. And for patients who have fixed insulin doses, individuals should be provided education about consistent patterns of carbohydrate intakes with respect to the time, so when it's eaten and when it's administered, and how much is being consumed. It's really important to talk with your doctor about what we call correction factors. So for however many carbohydrates you're consuming, when your blood sugar, how much that might raise or lower per what you're eating. So it's really good to talk with your doctor about correction factors and figuring out per each carbohydrate, how much insulin I might need to take. If I substitute one carbohydrate for another, how much insulin would I need to take? And figuring that out will also make meal planning with carbohydrates much easier. We're going to talk about protein, which is another very important component. So ingested protein appears to increase insulin response without increasing glucose concentrations. So overall, protein is good. We want patients to eat a meal full of protein, and balance is also important. So we have seafood, so fish, shrimp, or lean meats like lean beef, and lean chicken is also an amazing option. So dietary fat, which is something that when we're talking about meal planning is not really something we think about per se, but dietary fat is incredibly important. We're talking about things that kind of creep into our meal plans. We don't really think about how much oil or how much butter we're using, but according to the ADA, dietary fat matters. So the ADA emphasizes elements of a Mediterranean style eating pattern. So this means using monosaturated and polysaturated fats. A really good example of this is olive oil. So adopting a Mediterranean style eating pattern using olive oil can improve metabolism and also at the same time lowering your risk for developing, heart attack, myocardial infarctions, really diseases that involve the heart and the cardiovascular system. Another thing that the ADA mentioned, which I'm glad they did, is meal balancing, right? So overall, reducing carbohydrate intake for individuals did demonstrate the most evidence. However, there's no ideal macronutrient pattern for people with diabetes. So we're jumping right back to that point where meal planning is very individualized. So finding the best meal plan that works with you and also works with your provider is the best bet here. So now that we've went through what the ADA recommends, what they put in their 2022 guidelines, now I'm going to digress more into the meal plans that I have mentioned, but I do have to add a disclaimer that the ADA doesn't approve one or the other. Matter of fact, the ADA doesn't approve any of them at all. These are just examples, but the ADA did, and we've talked about it within the previous slides, give guidance about macronutrients individually, and then you can tailor what the ADA says and formulate a customized meal plan. So the first example might be the most popular example. I remember hearing the Atkins diet for a while now, but this is like your traditional low carb diet. It's a diet that's extremely high in protein, very low in carbohydrate. And the goal of this diet plan is to limit carbohydrates to about 100 grams per day, which is not the most ideal, especially for type 1 diabetics who use insulin more. They need insulin, right? 100 grams per day is a very minuscule amount of carbohydrates. Typically, we recommend between 130 I've seen some patients have around 145 to 200 grams of carbohydrates per day. So this is limiting, but the goal is to limit blood sugar spikes that result from simple sugar consumption. And Atkins does have in their mission statement to help maintain energy levels throughout the day. Again, this is probably the most extreme. Not really recommended because the extremely low carbohydrate intake, which is about 100 grams or less per day. The next one is a plant-based diet. So this is when we're omitting all animal products, no animal products at all. The goal is to primarily focus on consuming plants for daily nutrition, plants, fruits, and vegetables. So we have a diet that includes a focus on beans, legumes, vegetables, fruits, and healthy grains. Plant-based diets have been shown to lower body mass index and therefore really seems to be more helpful in those with type 2 diabetes. The next one is the Pescarian diet, or better known as the seafood diet or meal plan. And it's a meal plan that's derived from a vegetarian diet. So focusing more so on plant-based foods. However, we're incorporating seafood as the primary protein source. So the goal overall is to limit the consumption of land animal protein. So no chicken, no beef, that can cause blood sugar spikes, insulin spikes, while also relying on beans, legumes, vegetables, fruits, and healthy grains to maintain a balanced diet. I think of all of them, this is probably the easiest to adhere to, only because you do have a definite protein source, which is seafood. Next, we have the Mediterranean diet. And this is when we're incorporating components of a plant-based diet. So we have beans, legumes, vegetables, whole grains, and fruits. However, olive oil is the main source of added fat. And we actually did talk about the added fats that the ADA addressed, and they did recommend a Mediterranean style, like monosaturated, polysaturated fat, and olive oil is a really good example of it. And the goal is to really target heart health. So this one is kind of like the best of both worlds. We're targeting diabetes management, and we're also focusing on heart health, reducing cardiovascular outcomes. And because having diabetes, and this is something that's very important, it does put patients at risk for more advanced illnesses that affect the heart. And we've talked about, heart failure and myocardial infarction and heart disease. So this helps by choosing a diet, right, that accommodates both aspects, and furthermore will limit the progression or the fast progression of diabetes and therefore heart illnesses over the course of time. So now that we talked about the first strategy, which is finding a meal plan that works, now we're going to find an exercise routine that works. And I've included towards the right here, the American Heart Association's recommendations. So we know that exercise is crucial, not just for patients with diabetes. I should specify exercise is important for everyone, but it's really crucial for patients with diabetes. And exercise increases insulin sensitivity, which means that when we exercise and we're eating something, insulin is more efficient to putting that glucose into cells and using that glucose for energy and proper storage of energy. And this means that less blood sugar is being circulated in blood plasma and more is being used for energy. This is a double thumbs up. This is a great thing. And the American Heart Association recommends 150 minutes per week of moderate intensity exercise, joining a fitness class, incorporating meditation, and even dancing. So if you watch Grey's Anatomy, they have like the random breakout dancing. That also helps and can add fun to your workouts. And towards the right here, We've talked about the 150 minutes, but the second point there is move more, sit less. So I know if anyone has like a fitness watch, it probably buzzes you every hour, tells you to get up and walk around and move. That helps. If you already have an exercise plan, adding intensity to it strengthens the heart, adding muscle. So a lot of my friends, a lot of people I know, they only use the treadmill, but I encourage everyone to pick up 5 or 10 pounds worth of dumbbells and just do some arm curls. Incorporating more resistance exercises not only improves balance, but you feel better overall. The third tip here is monitoring adherence. So medications matter. If we're not taking our medications, everything else that I'm talking about today can almost go out the window. Medications are a really crucial part to diabetes management, and taking medications as prescribed is super, super important for diabetes management. So please be sure to take medications as instructed. And I did do a blog post on forgetfulness. So if you forget to take your medication, utilizing your pharmacist, asking your pharmacist about tips to adhere to medications, or using pill packaging services or devices, putting your medications in areas of your home you're in frequently to remind you to take your medications every day, or mobile apps, developing a support system, which we'll talk about a little later. But all of these methods are used to really help patients adhere to their medications, especially for type 1 diabetics. One missed dose of insulin can risk putting a patient in, diabetic ketoacidosis, or, so missing doses of medications can allow things to go really south really quickly. So adhering to medications, super important. And the longer you adhere to your medications, this strategy will be amazing for successful management of diabetes. So the previous point I mentioned was developing a support system. I genuinely believe everything we go through in life is better with others who are on our team supporting us. Diabetes is life-changing, and for some, it's more life-changing than others. So allowing others to be included in your personal health goals helps maintain accountability and responsibility to adhere to your medications, exercising, and eating the best you can eat. Support systems emphasize and encourage healthy lifestyles, and they help you realize that you're not alone. We have about 11% of the population within the United States that has diabetes. So you are not alone, and including more people into your support system will actually help. I promise you it will help. Helping hands are always incredibly amazing. And I've actually, incorporated, aside from diabetes, anything when it comes to lifestyle. And it's amazing how just one friend mentioning something could help kind of like jog your memory and also like improve your adherence to small daily tasks. So this next one, which is checking blood glucose levels frequently. I included the frequently because it's very important to check your blood sugar daily. Checking blood sugars with glucose monitors. I have an example here of the One Touch. There are other continuous glucose monitors that have been out. So like the Freestyle Libre that allows you to scan, or like the Dexcom. Both help analyze objectively how well diabetes is managed. I've provided a suggestion, but again, like this, or like eating, it's tailored toward you. So just a suggestion. So checking your sugars upon awakening. This is so important because if we're starting with a higher blood glucose as soon as we wake up, might change what we're eating for breakfast. It might change what we're eating throughout the day. Checking before meals are always incredibly important. We often recommend checking 2 hours after each meal, just to see, what we're eating and the impacts of what we're eating long after we have consumed the food. And I actually love the 2 hours after each meal, only because if you have a carbohydrate rich meal it's really easy to pinpoint what it could have been that spiked your glucose and left your glucose a little higher than usual, which also allows the customization of meal plans and helps decrease the progression of diabetes. And then I have here at bedtime. I think the bedtime one is just as crucial as all the other ones. Seeing where your readings are before bed can also, in a way, project how it'll be in the morning. So making sure we're ending the day with a glucose reading, we're beginning the day with a glucose reading before meals, and then about 2 hours after each meal. That's suggested. But again, if your primary care physician or your PCP recommends another regimen, please follow guidance from PCP. And I've already noted or alluded to it earlier, but seeing high readings also could suggest potential diet and exercise changes. So I like to think that checking blood glucose levels frequently allows you to be very cognizant of what's going on with your body and what you're doing and what you can do to improve. And that hyper awareness is always very important with a chronic progressive disease such as diabetes. Generally, a good range is between 80 to 130 milligrams per deciliter. For continuous glucose monitoring, it's a little different, but generally speaking, for the normal blood glucose monitors, we try to have between 80 to 130 milligrams per deciliter for fasting values. And then for our sixth tip, which is my favorite one, have fun. It's important to know that living a healthier lifestyle is fun. It might not seem fun at first, but we are humans who are creatures of habit. And when we're making something a habit, it is so easy to make it fun. It allows you to live life to its fullest and also allows you to manage and take control of your current health status. So finding fun activities that keep your activity levels high, or even joining a cooking club or joining a fitness class can definitely enhance your experience with diabetes. Having diabetes is not the end of the world, although initially when you're diagnosed, it might seem like the end of the world. And I promise you, there are ways to incorporate some of these strategies to embrace yet empower the diabetes management so that you can take control of your life. And the last tip I have here is getting involved. I love this tip because I love volunteering and I love how good it makes me feel. And it's not limited to diabetes. So support diabetes awareness, allowing yourself to be a speaker to other patients who have diabetes definitely increases your awareness and also monitors, how well you're doing with diabetes, right? Sometimes they say it takes one to know one. And a lot of patients can look to you if you have diabetes as an advocate and help them with their diabetes. The American Diabetes Association has many local events, such as local walks, local cycling events, and fundraisers that really allow patients to get involved with their health while also advocating for others in the overall movement of the American Diabetes Association. So I encourage everyone to try the Step Out, which is the walk that the ADA has to raise funds to show support for people with diabetes, and Tour de Cure, which is a new one for me, but it's a cycling fundraising program. So just a general summary slide. Type 1 diabetes, we've talked about, as a chronic condition in which the pancreas produces little to no insulin. The net result is high blood sugar. Type 2 diabetes is still a chronic condition. However, it affects how the body utilizes insulin to lower blood sugar. And we talked about patients could secrete too little insulin, resulting in high blood sugar because we don't have enough insulin to pull that glucose into cells so that the cells can use it for energy or storage. And then we've talked about too much insulin or insulin resistance. So the insulin is being secreted, but it's not properly allowing that glucose into cells. We've talked about empowering diabetes management and how it's giving priority and authority to oneself to embrace the new lifestyle of diabetes and manage their diabetes. I call it taking charge of one's own life. We've talked about meal plans. We had 4 meal plans, about 4 to 5, and overall, they're very individualized. So what works for one won't work for another, but it's tailored toward you. We've talked about exercise, 150 minutes. Exercise increases insulin sensitivity. It's crucial for diabetes management. I say crucial for everyone, but especially for patients with diabetes due to, cardiovascular issues or heart illnesses that diabetics are more susceptible to later on. Overall, medication adherence matters. There are ways to adhere to medications if you forget, and we've talked about a few of those. And checking blood sugars objectively allows you and your provider to analyze how your diabetes has progressed. And also getting involved with your community allows yourself to, show awareness of diabetes, and also involving yourself in your community. It really makes one feel really good. So overall, that is the end of my presentation. Here are my resources here. Special thanks to all of the individuals that have allowed us to experience this. I thank NEOMED and faculty advisors for allowing me to present to you guys today.